them an eggplant and some squash, they're going to throw it away because they don't know what to do with it. So to me, lack of nutrition, lack of understanding leads to so many of our health disparities. And if we were able to tackle and really help people to understand, I personally feel like in high school, you should be taking nutrition classes. We need to bring back cooking classes. I personally took home ec and learned how to make stuff, people actually learning how to cook nutritious meals versus us eating only fast food, canned foods. Let's not talk about the toxins that are existing in our canned food, right? I mean, the toxins if you turn over a bag of anything, if I'm a biochemist, I understand what those weird words are. Most of the society doesn't. And I also know that some of this stuff should not be in our food. So I'm very, very passionate, if you cannot tell, about getting rid of foods that are not helping us and they're only harming us, and starting it from very, very early. And I really think that if we pay more attention to nutrition and also the environmental toxins that are impacting us, we actually would see improved rates in terms of infant mortality and maternal mortality and morbidity. And I mean, I know that I'm just there's different, studies and different things out there talking about some of these things, but of course there's a lot of clashing because the reality is we live in a country that is based on capitalism. Capitalism runs our health outcomes. And until we actually stop putting price tags on things and we actually are looking at how do we really improve outcomes, then we're going to struggle. And so I know that's not something that's going to be fixed overnight, but I really want people to be more aware of how many decisions are made which are solely based on capitalism. Like, we allow certain things in this country that are banned in other countries. Even looking at infant formulas. When I have the parents order from Germany, the first ingredient is not corn syrup. Like, that upsets me. Yes, I get upset when I see corn syrup as the first ingredient in anything that we're supposed to be giving children throughout their day. And of course, we want to encourage breastfeeding, but we always know that sometimes it just doesn't happen. And so I think that is one of the biggest things that I see, something that I'm obviously probably overly passionate about. But I'm even part of a Black gardening group trying to encourage people just to grow their own food, and learning to eat different things. And I think there's a lot of projects trying to do some of those things, and I think that that's one of the biggest ones. But of course, starting from the mother before she even conceives and or gives birth, improving that, and I think we'll see a lot of improved health outcomes.
All right, thank you for that. Next for Ms. Green, if she's ready. We know that for new moms, talking with their healthcare providers, of course we have a train going by. Hope that doesn't, hope y'all can still hear me. We might wait just a second.
Yeah, as I said, give it just a second.
Give it just a second. And that was really good timing. On his horn anymore. Okay, so we know that for new moms, talking with their healthcare providers about a postpartum care plan is important for a multitude of reasons. As a licensed clinical social worker, you specialize in postpartum depression. Oklahoma is already challenged with higher than average mental health disorder statistics. What can we, all of us here today, kind of in the maternal child health field, specifically do to help women adjust to motherhood and ensure that potential mood disorders are being addressed correctly?
This was a very good question. Because as a clinician, I believe it is very important to do the pre-work before we have this baby come. The more we can prepare mom, one of the biggest things that I realized, just something as simple as having a journal and being organized is huge for mothers. Write down doctor's appointments. Write down things such as who your doctor is, nurses you encounter, issues associated to your health, issues associated to things of the infant. I realize that when we get more organized with journaling, and also too, I'm a certified financial social worker in talking about our money and budgeting. So we want to reduce the crisis or even having a crisis if one even occurs prior to us having the baby. So, which alleviates the depressive type symptoms. When we feel more in control, it alleviates our depression and our anxiety. So when we get that alleviated, just working on basic case management skills. I'm counseling per se, but I'm really not. We're working on case management type skills, making sure they have the appropriate resources that they need in the community. If they're having housing issues, if they're having issues and needing baby items or pregnancy related resources, getting a crib, baby car seat, things of that nature. So when we alleviate all those problems in the beginning, I find out that once mothers who may have high stressors as such in alleviating these things, once we do have the babies, when we come out on the long end, I see that our postpartum depression may not be as significant or may not even arise, because we feel as moms that we are in control. And so with that being said, if I can definitely assist a mom at the beginning during pregnancy, I definitely realize that working to alleviate stressors is the biggest thing. I think one of the most important things is in working with moms, especially moms of lower socioeconomic class or moms of color, transparency is key. You need to understand what the health inequities or the racism or discriminatory things associated to you in moving forward with being pregnant. I feel like in those instances, with understanding that what things that are working against you, in working with them to figure out, well, how can we make it to the best of our current situation, also reduces postpartum depression. And so with that being said, about 1 in 5 moms will experience postpartum depression. Along with postpartum depression, their cousin tags along postpartum anxiety. When you can take care of one or the other, the anxiety or the depression, the other one will be alleviated. And also too, with that being said, in dealing with perinatal mood and anxiety or disorders, I noticed that dealing with African American women, I'm noticing more PTSD associated to them in dealing with things maybe that has to do with things associated to deliveries or issues associated to the experiences that they've had with their infant that can be traumatizing for them. So with that being said, like I had identified, I think great preparation, understanding your situation, what you're currently dealing with, meeting clients where they are is very important. Please listen. That's what our moms want, is for you to listen. If we listen, then we are able to care and give the quality of care that they need accordingly.
All right, thank you for that. And so, of course, last but not least, Ms. Whitaker, you are a vocal advocate for breastfeeding and modeling to Black moms that successful breastfeeding can be accomplished. So what obstacles have you faced in your breastfeeding journey and as a young woman of color?
Okay, so I'm sure we all know that Black women have the lowest initiation and duration rates when it comes to breastfeeding. And it's a lot that goes into that. Some of that is with our history with slavery and more, but I don't want to go into that. I will say with that comes a lot of pushback from moms when I'm trying to help them. I've noticed that Black moms are so much more lenient on giving up, not wanting to try as hard because it's just so easy. Because, well, my mama didn't do it with me, my grandma didn't do it with me, they just told me to go ahead and stop because it's not worth it. As opposed to white moms that I've helped before, it's more of a community when it comes to them of they want to help, they want to seek out the breastfeeding resources and the assistance. But I've noticed that when it comes to Black moms, it's easier for us to just give up and not even want to try. And it's just, oh, I'll just give the baby the formula. Now, of course, I do understand there are some women who just can't. It's just really hard. And her mental health comes first, obviously. But sometimes moms just really need that push. And it's just a lot of pushback sometimes, not with all Black moms that I help, but the majority of them, it's more of a pushback and they're just so easy to just give up rather than sticking with it.
And usually I have to be that cheerleader in their ear, pushing them to do it. And then they'll continue after they see the benefits of it and everything and read on and just get that support. And sometimes they just need the extra push. But I've just noticed that it's more prevalent in our community that we just give up. And it's just, oh, it's okay, I tried it in the hospital, it didn't work, so now I'm just gonna do the formula. But it's like, well, did you really try? Well, no, nobody told me what to do. I didn't get it. It hurt. Breastfeeding was hurting. Breastfeeding shouldn't hurt. Well, let's talk about it. Did you assess the latch? Did you check for tongue ties? Well, what's that? I don't know what that is. So it's lack of education. So that's the most frustrating part of it, I will say, helping. Now, of course, it doesn't discourage me. I'm gonna continue to help mamas, anybody, of course. I don't want to make it seem like I'm only helping Black moms, but my passion is with women that look like me because we're the ones who are suffering. So yeah, that's what I've encountered and what I still encounter today. I had a mom the other day that I was helping. Somebody tagged me on Facebook for her status. She needed help. And it was so many people just telling her, girl, don't worry about it. Give that baby formula. And it's like, well, can we encourage her first? Let's see if there's really a problem for her to really give up. And I DM'd her my number and she just texted me yesterday morning and she said, everything's good. Baby is latching just fine. She just needed the extra push. And I'm like, yeah, I know. I didn't say that, but I'm like, in my mind, like, yeah, girl, I know. It's okay. I will continue to be your cheerleader. But it's just those situations that are frustrating for me. And it's just like, again, I know it's a historical thing. It comes from, us being forced to feed. I don't even want to get into that. Anyway, yes, that's it. That's it. I'm gonna stop myself because that's a whole another Zoom meeting. Okay, we're not gonna get on the historical trauma that came with that. But okay.
I know that might be a panel session number 2, right?
Mm-hmm,
So
mm-hmm.
everything we didn't get to say today. There's never enough time. So I'm gonna just pause and see if anyone in our audience has a specific question for our panelists related to those initial questions before we move on. And feel free to either unmute yourself or type something in the chat box. We'll give everybody a minute to think on that. Okay, I would love to hear a quick synopsis of the historical trauma related to breastfeeding. That's from Sarah Nicole Johnson, who's with our Office of Perinatal Quality Improvement team.
Dr. Abdul-Haqq, would you like to give a brief synopsis on that? I feel like you'll be able to keep it well rounded because I'm gonna be passionate.
I actually may share an article that goes into a lot more in depth, and I think I have it on my phone, so I'll try to find it. But just historically, Black women who were slaves had to breastfeed the master's children, the white children. They actually were not allowed to breastfeed their own children. So many of those children were more sickly and more needy, et cetera, because they lost out on that bonding experience with their mothers. And so it almost became a stigma of like, not wanting to breastfeed because you had to breastfeed your master who may have raped you, who was beating you, et cetera, their children. So you didn't want anybody, really suckling on your breast. So that's kind of historically how it, that trauma that kind of came down through the generations and things like that. So I leave it at that, but I can share some, there was a website I recently was on that I can share with it, but then there was also another push several years later with more of like women's rights, to where Black women were encouraged to be more liberated and, use formula, and it was pushed to not breastfeed your children again. So we kind of had different waves of things that have occurred over the years. But feel free if anyone wants to add. I don't know if that was too vague or.
That was perfect. That was perfect.
And I'm just checking the chat box. Yeah, if you have an article or website that we could direct people to for their own learning journey. And I would encourage everyone, especially our white attendees, to do your own research and learning. And so we do have another question for Ms. Green. What are some key ways to frame effective listening for the mothers that you serve?
Can you repeat the question, please?
Yes. What are some key ways to frame effective listening for the mothers that you serve?
I think ideally, like I really cannot iterate anymore as far as listening. I think when you sit one-on-one with somebody, even nonverbal communication matters. I'm looking at you, I'm listening to you, your thoughts matter, appropriate nods, appropriate responses are very important just to develop rapport. And I think you always want to develop rapport and have that empathy, because for women of color and women of low socioeconomic status, sometimes our rapport is not very valued when we step into the hospital component. And so with that being said, you also want to make sure too, in moving forward with moms and listening to their story individually. Mom A and Mom B are going to be two different stories in moving forward with motherhood and their experiences going through pregnancy. Cultural, ethnicity, even LGBTQ parents who are pregnant, you know, are going to be different in the approach. I definitely want to encourage understanding the population you are working with, as far as, for example, African-American women have a high rate of prematurity. So you want to understand what that looks like, what prematurity looks like. March of Dimes is a great website to look and understand prematurity associated dealing with African-American women, how they have about 20% of their babies born before 37 weeks, which of course cause a whole open bag of issues dealing with mental health. Now we're dealing with the mom who has a baby who may have some health issues, chronic health issues in the NICU. So you want to understand the dynamics and the population that you're dealing with. The Hispanic population, you want to make sure you have appropriate translation there if you do not speak Spanish, because they are able to relate comfortably with the translator in making sure that we hear and understand their needs, and that they understand our feedback as a care professional for them, and understanding their social support dynamics. They're very family oriented. And so that's what I would say as far as moving forward with making sure you guide questions and gear questions accordingly. Definitely do your research and understanding specific populations that you serve, and even areas you serve. Social determinants of health matter. Serving an area that doesn't have a food desert matters. So that would be my feedback on that.
All right, thank you for that. So I'm just checking, we have a couple more questions. There's one from Ms. Whitaker, and then I'll circle back around to one that I think probably any of our panelists could speak to. So this one is from Heather, and she would like to hear what you feel is the best way to continue to support a mother of color if they seem resistant due to their mother or grandmother suggesting formula. So as a white breastfeeding counselor, how to be motivating without it being received in a condescending way, and instead validating their unique struggle.
I would probably say it would be education, mainly to getting to the root of why. Of course, you want to be conscious of how you say things and what you say, but if she could figure out a way to ask her, you know, well, what is the root issue? Why don't you want to continue? And if she says, well, my mom and grandma said I need to, then, you know, let's take a step further. And like, you know, well, why? Why do they feel that way? Well, I don't know. Okay, well, let's talk about the benefits of breastfeeding. Let's talk about what happened for you and baby. Let's talk about if you continue to breastfeed, how your chances of receiving ovarian cancer and breast cancer and diabetes, your chances of that goes down. So let's forget the baby for a second. Let's talk about you. Let's look at some health benefits for you. We all know that the benefits of breastfeeding is phenomenal and out the park and out the water for babies. But I think a lot of women don't realize the benefits it comes when it comes to them. So if just education, getting to the root of it, why do you want to give up? Is it just because you don't want to do it? Okay, I need a better answer than that. You know, we got to get to the root of it. And we got to quit being scared of asking and not, I don't think you're going to offend her if you're truly trying to help her. I mean, she can feel that vibe. And even if she really is trying to help her, do you have a colleague in your organization who looks like her that you think maybe could help her? If not, then again, conversation is everything. Letting her know that, you know, you really are there for her without sounding condescending. Education is just probably like the key.
All right, so let's see. So I'm going to circle back around. This was a question about support. So support was touched on by each speaker. What is something you wish Oklahoma had available or would improve on for its new or expecting parents? So I'll just kind of open that up to, you know, any of our three panelists. What is something support-wise that you wish we had or maybe could improve upon for new and expecting parents?
I would say that for me, and I do know that we have some young ladies on the call who are really, this is their passion. It's not my passion. They just educated me about it here. But I really wish we did a push for doula services. I personally had a doula for my first pregnancy with my twins, and it really was the difference between me only having baby blues versus full out postpartum depression. Okay. And I think that if mothers had that support and could get it at a discounted price or even included in their insurance, we would actually see a lot more mothers able to breastfeed, because you literally have a coach, right? Somebody who's only there for you, who's your cheerleader and you know, and supporting you. And I do think that if there was some way for us to find more grant funding and things like that for doula care, especially in high risk populations, we would see better outcome. We have studies out of New York. My friend's running a grant out of California. I mean, we have those, you know, there's those opportunities, but sometimes it's just difficult finding the money, the people to train, the consistency, really getting the manpower behind it. And I think that that's something that we should start to look into and invest in.
All right, so Ms. Green, yeah, looks like you were ready to say something.
Yes. In dealing with coming from a mental health perspective, you know, I run across moms that do deal with grief of losing their babies. So I definitely do recommend to moms things associated to like KJE, Kids Joining Eternity is a good group. As far as dealing with grief loss and dealing with the baby, postpartum support groups, some postpartum depression, support groups. I've seen some hospital run some of them, the specific hospital that they go to, and definitely I even encourage physicians who I speak to even pay attention to things. Even you all healthcare providers, to reach out to people like me when you see a mom suffering from a potential postpartum, you know, illness. And the thing about it is, we'll see what this Medicaid expansion is doing. We know that with the current Medicaid situation that we have, we can't really encourage, unfortunately, moms to get postpartum mental health support with our current situation we have now. Just due to the timing of when it terminates, when it expires. So with that, with the Medicaid expansion, I know we'll talk about that here in a little bit. I'm hoping for things to get a little bit better dealing with postpartum mental health.
All right. So I'm just checking. So just to let everyone know, Dr. Abdul-Haqq had posted a link to an article on the impact of institutional racism on maternal and child health, so everyone can tackle that in the chat box. And then just kind of a follow-on comment about the doulas. Cleveland County has a doula program for women who qualify, similar to WIC qualifications. Amy Pomerantz and I are doulas for that program. Please look into the Birth Partner Program at the Cleveland County Health Department. It is of no cost to mothers. So, and then on the, Ms. Green had mentioned about perinatal loss, and Sarah just posted a link. The Oklahoma Mothers Milk Bank and Oklahoma Breastfeeding Resource Center are actually hosting a training Monday morning on that very topic about perinatal loss. And we have a licensed social worker who will be co-hosting that training, and that's free on Zoom, our friend Zoom yet again. So that's in the chat box as well. So now I see another question. What are we doing in the communities to rally around mothers who are struggling? What programs or support groups do you refer mothers that you work with? What support groups, programs do you refer moms to that may be struggling? So whichever of the three of y'all want to.
I would let Maggie hit this, because I'll be honest with you, that's what I struggle with, is when people have these problems of where do I send you to? And I'm also often asking people to find counseling, and they can't find anybody who takes their insurance. There's a very, very long list. Psychiatrists are full. They don't accept Medicaid. So please.
And that bounces off what I was in regards to Medicaid ending six to 8 weeks post delivery, and so therefore we have 60 to 70% of our moms who have babies are on Medicaid. And so with that being said, we have a significant amount of moms that are uninsured during a time when you would see your postpartum depression start to show, which is in the 3-month and 4-month range. And so unfortunately, things will have to be free. Most of the time when individuals are on Medicaid, they're looking for free cost services, or unfortunately they can't afford it at all. The Oklahoma Department of Mental Health and Substance Abuse does have a list of therapists that offer maternal mental health. And that with that list, it's multiple providers throughout the state of Oklahoma, and also too, you can definitely go through the Oklahoma City County Health Department, maternal and child health. As far as it's concerned, like I identified infant loss program, it's unfortunately, we do lack a lot of support. As far as having postpartum depression support and support associated to other issues associated to women and families. But we do have some parenting programs that we do encourage that do help alleviate going into postpartum depression for families, such as family expectations. I definitely refer to, that's a good program to refer to for parental development and associated in taking care of an infant. So those are some good resources at this time.
And I'll just add, we do currently, with the clinic, the free clinic that we're opening, we have one like psychiatrist that's going to be coming on board. So, hopefully as time, we just opened in September, so hopefully as time goes by, we'll be able to offer that service. I will say that there are some other free clinics that offer psych support. The Shifa Clinic, that's off of Northwest 39th Street, they do have psychiatrists already, and they have free medications as well if you have somebody that's going to need medications versus just the counseling. But our goal is at the Clara Community Health Center to eventually be able to have the free counseling and those free services. So, hey, you guys, whatever you want to donate, it's a free clinic. Nobody gets paid. Let me know.
All right. Well, I'm going to, ask another question here and just remind everyone, if you haven't been checking the chat box, certainly make sure you take time to do that, because there's other good comments and things that you can take a look at. So, all right, so this will be just kind of a question for all three of our panelists. A July 2020 New England Journal of Medicine editorial stated, "Slavery has produced a legacy of racism, injustice, and brutality that runs from 1619 to present. And that legacy infects medicine as it does all social institutions." So as women of color, how has racism affected your ability to access and provide quality health care? So whoever wants to tackle that first.
I'll go ahead and try. Statistically, it shows from National Institute of Health in dealing with maternal care that Black women who have bachelor's degrees plus, unfortunately, deal with systemic racism and discrimination towards their care 2 times more versus a white woman who has a high school diploma or less. So with that being said, all 3 the door due to our color of skin, PCP care, we are just at a disadvantage just with the color of our skin. But the advantage that we do have is knowledge and education and knowing how to advocate for our health. It does give a challenge for me, for myself, in making sure that I do receive the appropriate care that I need. I follow the same guidelines that I would tell mothers that I work with. If a physician does not listen to you or you do not feel valued, it is time for another one. And that is exactly what I live by as well, being a woman of color and getting the needs met that we, in all of the inequities that we deal with, the morbidities, the higher rate of diseases, really in researching, it really has a lot to do with the racism that we encounter and the lack of care that we receive in going into our doctor's offices. And so with that being said, it's really about empowering yourself to want to be heard. And that can be very intimidating going to the healthcare system, very, very intimidating. So I just really encourage mothers to, and also women of color in seeking the care they need, just to definitely be empowered and journal everything.
I have a comment. And I would be crazy if I didn't say this, but I feel like I have to say this. So we all know that Black women, Black men, whatever, we always sometimes receive the short end of the stick. We're always discriminated against, and sometimes it seems like we're singing that same song. But when we have these conversations and these open dialogues, we really get to the root of it. And usually people are like, oh, I didn't know that, I didn't understand it. That's why conversation is so important. So I do want to say that I just want to challenge all the people that are not Black on this call. When you see something, you hear something, you see discrimination, please speak up. Because when we do it, it's like we're being crazy, or we're being, or they're just saying it's a Black thing, or they're being mistreated just because they're Black. But sometimes it really is just that. And it's just discouraging for us when nobody else is speaking up for us. So anybody that's listening to this and is viewing this, and I'm pretty sure there were some aha moments, especially with the slavery comment on why we do have trauma with breastfeeding. A lot of you probably didn't know that. That's why education is so important. So I'm challenging each and every one of you, if you see something, say something, speak up, be an advocate for somebody that can't speak because nobody will listen to them because their skin is not white. And I hate that everything is about race, but it is. That's the country we live in. So I just want to just say that and make sure that everybody understands that on this call. Like I said, if you see something, say something. Even if you're in Walmart and you notice that the teller or the cashier is treating somebody differently because they're Black, say something, call them out. Because when we do it, we're crazy. We're the crazy Black woman, or he's an angry Black man, but because we're tired. So I just wanted to just say that, and I'm done.
I guess I'll just add to that in terms, it's just definitely multi-layer, and definitely agree with what Jillian just said. But, as an African-American physician, there's very few of us. I make up 2% of physicians are African-American women, 2%. Okay, we make up way more than that of the national population. So that's ridiculous, basically. But I think that because very few people have actually seen an African-American physician, it creates an issue. I have people who, to be honest with you, don't think I know what I'm talking about, and often will challenge me or things like that. Often referrals that I get, I only get Medicaid referrals, right? I always laugh at that, right? People are like, oh, she's so wonderful, but do you come to me? would you bring your child to me if I'm that wonderful? You know, but I see that bias, and it's like, well, to be honest with you, people just, that implicit bias, right? You see me, and I don't know, you know, and a lot of people think I'm foreign. So this, once they realize I'm not foreign, it's like, whoa, because the foreign docs, they often get the respect, right? But for some reason, me, born and raised in Oklahoma, I'm often seen as less than. And so I often spend a whole lot of time to try to prove myself to people. And I realize, you know, I don't care. If you want to go see so-and-so who doesn't know anything about your culture, your race, your religion, doesn't care about those things, you can do that. But I know that it makes, sometimes you get a chip on your shoulder, especially a lot of us African-American physicians here, because it's even hard sometimes partnering with people, right? You want to, you know, partner with this person or get referrals from this and that. And there's often that bias. And it's so interesting because people will tell you how wonderful you are to your face, but to me, actions always speak, you know, much more greater. And that does impact, I think, sometimes the access to care and things, because sometimes those collaborations don't occur. And sometimes you have some second guessing, because I often laugh if I refer a patient out to a specialist and then you have the patient see the mid-level and they do the exact same thing I already did. I mean, like, that didn't help my patient at all. Why are my patients always seeing the mid-levels and they never get to see the physicians, right? So I had to call and create a little ruckus. So now my patients get to see physicians too. I don't care what their insurance status is, because we know that my Medicaid population that I do see is often the more sick population. And also remember that our adopted children and our children in foster care who have tons of trauma, tons of adverse neglect, nutritional issues, etc., are on Medicaid. So when those children are not allowed to actually see the specialists and things like that, it just makes me feel, you know, very upset. Unfortunately, a large population of those children, of course, socioeconomic issues come into play, but a large population are African American children, as a lot of us do not get adopted out of the system and remain in foster care.
All right, so I'm just doing a time check, and I know we got started a little bit late. And if our panelists can maybe hang on for one more question, and I'm also going to read one of the comments because it relates to something that Jillian said. In the sexual violence prevention realm, we talk a lot about being a proactive bystander. Thank you for bringing that up. When we see injustice, we should stand up to help elevate the voices that do not feel empowered. So very much agreeing. Very strong statement there. So, so maybe one final question, because y'all have talked a lot about the implicit bias in maybe even within the healthcare system, and we've kind of heard some things about this, pushback on this at the national level. So what are your thoughts on mandatory unconscious bias training for all health professionals? Anybody care to bite on?
Obviously, as a physician, we have there are some trainings actually out there. The pediatric, American Academy of Pediatrics, we actually have a whole statement now, and we're doing trainings within our residencies. But the reality is we can train physicians, but if you didn't train the support staff and everyone around them, you're not going to get it. The problem is there's not a lot of money, there's not a lot of buy-in, especially since the president said it's un-American. As long as we don't actually discuss the foundings of this country, then we'll never really be able to get past implicit biases and racism if we don't acknowledge the fact that Christopher Columbus came and to destroy our indigenous people. But whatever, that's neither here nor there. But if you didn't read that statement that came out of the White House, you should. But as long as we ignore things, we'll never really be able to get where we need to. So I think that training is important. And there's lots of different agencies that already have these things created. So you don't even have to create them yourself. You can reach out to those entities to come in and facilitate those implicit bias trainings, et cetera. But I do think that, and I know you said unconscious, but I think that sometimes I like to just call it what it is, right? And in teaching people how to do those things. But I know personally, I was trained through the, it's called the Gold Humanism in Medicine. So we actually take a humanistic approach, right? So instead of just focusing on implicit, those types of things, we just humanize people. And when we actually take that approach, we see a lot of improvements. Instead of me seeing you as your, you know, for other things, we're going to focus on the humanistic aspect of us, what makes us similar, things like that, which is obviously going to help with implicit bias just in general. Because yes, the African American community is suffering from some of these things, but I see it in the Latino community, I see it in the indigenous populations as well, and it's definitely something that needs to be tackled.
I have a comment again.
Yes, go ahead.
Question. Yes, all these trainings are great. They're great for face value, but we all know the real work happens when we're at home with our families. So I think these conversations need to be had like when you're out at lunch with your family, when it's just you and you're in your safe space with you and people that look like you can have these conversations. And I think when we, I guess, challenge each other or ask these questions that we would ask in those kind of trainings with our loved ones and see how they feel or whatever, and really get to the root of it, I think that's where the change is going to come. Because you can have all these great trainings, like Starbucks tried to do that when they got in trouble for some racial issues, and then like later they did it again. And again, it's great for face value and for press that we're doing these trainings because we're all going to love everybody because, you know, we all bleed the same. Yeah, that's great for face value, but we all know that that's what it is, it's face value. So these trainings can be great, but I feel like these conversations need to be had at the family table, at the dinner table, and really be honest and candid and open with each other. And only you'll know that. Only you'll know that. So I'm challenging, again, each and every one of you, when you have these conversations at home tonight, tomorrow, whatever, when you're out with your girlfriends or with the guys or whatever, you're having these conversations so that it can really change. Because I had a conversation with one of my friends who's white. She said that she didn't realize until, you know, she had a conversation with somebody that was Black about the issues that I face and everything, or just disparities or whatever. And she didn't know because she lived in this white privileged bubble. I mean, if you don't know, you don't know. And so she started having more conscious conversations with her family members, and it got really uncomfortable. And that's what it's going to be. It's going to be uncomfortable. So I feel like if we really do have these conversations in the background, at home, at the family table, that's where maybe the real change will come. But I just think these trainings for face value is just what it's going to always be, is face value. Yeah, it's great to try, but let's be honest here. So.
And I'm going to bounce off of that and round that up. I absolutely agree with Jillian is saying, because it starts in the home, because at the end of the day, hate and racism is taught.
That's right.
It is taught.
Mm-hmm.
And so what you are, when you come out of the womb, what your environment provides to you, what your guardian parental resources provide to you, what your system provides to you. And if you come out of the womb white, the system is meant for you. And so in doing that, I do want to definitely talk about, at the end of the day, it is about love. Please believe me. It is about being loving, and it is about being kind. Choose to act in love, choose to act in kindness, because choosing not to, it will never work.
I just wanted to add one thing. I completely agree, but I don't necessarily think I think we should do it in our homes, but I don't think it's just to save face. I think that it has to occur, because just like this setting, so many people learn something. So if we don't have the conversations, there's nothing to talk about at the kitchen table, because we didn't have the actual trainings and the tools. I recently, and I know we're over, but I recently had a mom reach out to me, a Pakistani woman who only hangs out with Pakistani people, who've had these conversations at the table, and they came to the conclusion that Black people are lazy, and that's why we don't get as far ahead as their people. So if she had never reached out to me, or got a little bit of extra training from me on the understanding some of these things and these biases and where our history, etc., she would have continued thinking, well, just Black people are lazy and that's why they can't get ahead. And once I literally talked to that woman for 2 hours educating her. And so I agree. Hopefully she took that back to her kitchen table, back to her conversations with her friends. But we have to make sure that we are making people think about it. And we're also giving them the tools and resources to find out more information about it. Because a lot of people don't think they're racist. They even talk around time, I'm an anti-racist. Whatever, no, you're not. You're still contributing to the problem. So I think that these conversations are necessary. I would like to see more education. And a lot of it is face value, but I will say that my I'll say pro-fight, they know what I'm talking about. My sorority sister is the person who implemented that diversity training at 4-Star Bucks, who's a Spelman graduate, anyhow. But it wasn't just a safe face. She was very passionate about it. And it may not have reached every employee, but even if she reached 20%, it was worthwhile, right? Because now they're going to go to the kitchen table and have those conversations as well.
Silence and non-participation is your answer to our problem.
Well, I'm just, looking at our time, and I think we've had a lot of great discussion today. And speaking from someone who's, come from a position of privilege, and my work over the past several years to try to learn more and understand more. And I think someone mentioned too about kind of the humanism aspect and loving and showing kindness, and I think empathy, trying to understand. So if we're trying to be a white ally and speak up, but understanding, and I just want to share one comment that really hit home to me a number of years ago at a national conference, and we just had a wonderful session, on racism and the inequities and so forth. And a Black colleague that I was there with asked the speaker, so I can go to the grocery store with my little 4-year-old boy, and everybody oohs and ahs, and he's so cute. And then when does my cute little 4-year-old boy, when he hits puberty and he has jeans and a sweatshirt and a hoodie on, when does he suddenly turn into a drug dealing, criminal or terrorist or what have you? When does that transformation happen? And that just devastated me to hear that, to think that, there's someone that I know and respect, and that's how you live in fear for your own family members to go out into our society. And so what can I do to help challenge that and prevent that from happening? Anyway, so just looking at our time, ask if any of our panelists, any other closing comments anyone would like to make or leave us with today?
I definitely always like to leave with something, because I truly believe, and definitely if you have never heard of it, please be educated on it and potentially learn about motivational interviewing and empowering others. It is very, very important to understand to when you're dealing with individuals who are of Medicaid, who are of low socioeconomic status, who are racially profiled, such as Blacks and other people of color. It is very important to empower them to want better for themselves. And I do that often, no matter the socioeconomic status, no matter the color. And most importantly, in speaking with people and helping moms in maternal and child health, you are your biggest advocate.
All right. I think we will, wrap this up. I know we went past time, so thanks to everybody's patience with our little technical glitches early on, but I'm just delighted that we were able to, successfully host this panel session. And thank you so much for making time out of your busy schedules to share your perspective with us. So thanks to Dr. Abdul-Haqq, to Ms. Green, to Ms. Whitaker, and we hope, to hear from you more in the future. So,
thank you for having us.
All right.
Thanks.
Thank you.
Oh, and last but not least, that was Heidi's job to remind me. We did have a little drawing for a free Amazon gift card. And Heidi, you want to announce who the winner of that is?
Yes, so thank you all so much for joining us today and our 3 incredible panelists. It was just an absolute delight to work with each of you up until this point. And we do have several other questions, and I think for another panel discussion, so maybe next quarter we can all get back together and talk continue to talk about these very important issues. So today's lucky winner of a $25 gift card, compliments of COBA, is a birth doula in our community, and it is Amy Pomerantz. So congratulations to Amy Pomerantz. She is a birth doula, and we will be sending that her way. And again, thank you so much for joining us today. We are so honored that our three panelists, Maggie and Jillian and Dr. Abdul-Haqq, were able to join us. Again, please follow us on social media. We're doing some really awesome things, I think, at COBA. It's just a delight to be part of COBA. And thank you, Becky, for serving as a fantastic moderator today.
This was fun, Heidi. Thank you.
Thank you, Heidi.
Bye.
Thank you all. Thank you.
Enjoy the rest of your day. Well, enjoy the rest of your day. All right.